Moving to session 2, we have Dr. Robin Yabroff joining us.
Hello, everyone. I want to just describe our panel. We were focused on opportunities to improve patient-facing aspects of EHRs, and there were a number of key takeaways specifics to some of the presentations. And so we had the opportunity to delve in a little more detail and amplify some of the issues that were addressed in the first session. So we had a discussion about open notes and how they've created challenges and opportunities for providers, patients, and importantly, patient-provider communication, with many challenges related to documentation burden, timing of information release, and patient worry, but at the same time, important opportunities for improving patient-centered care and promoting dialogue. We also had another presentation related to patient-reported outcomes and how they can be best incorporated into electronic health record workflow and inform patient management, population health, quality improvement efforts, and real-world data for research and both policy. So using patient-reported outcomes, of course, has challenges with reimbursement, but many opportunities for expansion of key domains and inclusion in payment models. We had another presentation highlighting use of patient portals and sharing data across systems with detailed discussion about codex and M-code and community of practice and standardization opportunities. We also discussed challenges with portability, computable guidelines, and computable clinical trial criteria. Next slide, please. And then we had a really fascinating discussion about the use of EHRs to nudge evidence-based care using both provider and patient-facing aspects. And then a wrap-up thinking about next-generation electronic health records, which are focused efforts to minimize documentation burden. And there's a 25x5 initiative. Also, the importance of use of data science for better interpretation of what we find reported in the records, and then opportunities for greater patient engagement, including a phrase called life records rather than only medical records, and more information related to different exposures and better opportunities for learning healthcare systems. Next, please. In thinking about some of the key sort of takeaways and recommendations that came up during the discussion, I think one of the really most fascinating topics was how we study electronic health record use and design elements, and ensuring that we study them when we're making these refinements so that they can be most effective. We can use our research skills to evaluate improvements in electronic health records. Reducing documentation burden was a topic that was described by just about everyone. But when we think about that, it's rarer to think about consideration of the costs of new alerts and requirements, not only to providers, but also to patients. And then finally, a central theme and recommendation is this need to ensure equity and developing guardrails to ensure that all patients are able to benefit from innovations. So with that, those were the main key takeaways and recommendations from session 2. And I just want to add that it was my honor to moderate such a fascinating panel.